Veterinary friends, welcome to Dr. Vet channel. I'm Dr. P.R. Patel, Professor of Veterinary Medicine. We have already seen the fibrous osteodystrophy part 1. Now we switch on to fibrous osteodystrophy part 2. In this we will study pathogenesis and clinical findings. Fibrous osteodystrophy is a disease of bone. Now, pathogenesis of fibrous osteodystrophy. The basic mechanism here is defective mineralization. That is one thing. Because of defective mineralization, there is rarefaction of bones. What is this rarefaction of bone? That is the thinning of the bone. Bone become thin. Thin not in size, but internally thin. Internally thin. Remember this thing. And because of this, the bone become light and weak or decreased density of bone. Normal bone is a compact bone. Here there is decreased density of bone because of the defective mineralization. In place, there is formation of cellular fibrous tissue instead of osteoid tissue. Normal bone has a osteoid tissue. Here there is deposition of cellular fibrous tissue. And because of this deposition of fibrous tissue and growth of the fibrous tissue, the disease is named as fibrous osteodystrophy. So by this below lines, it will be clear about the disease. Very important. It is characterized by osteoclastic resorption, bone remodeling and formation of new bone is a continuous process. Here, more technical term is osteoclastic resorption of cancellous bone. What is cancellous bone? Cancellous bone is a trabecular bone or spongy bone. Trabeculi are the pillars and beams and plates of the bone. If there is osteoclastic resorption, the bone becomes spongy, sponge-like. Also, there is osteoclastic resorption of cortical bone. Cortical bone is a compact bone. But when there is resorption, again it becomes thin, light, porous and decreased density. Now this osteoclastic resorption occur of this bone, but it must be replaced by some tissue. So replacement of this occurs by loose, mature, fibrous connective tissue. Deposition of fibrous tissue, growth of the fibrous tissue. And so the disease is named as fibrous osteodystrophy. This is the main thing. Continuation of the pathogenesis. Initially, bone is compact and hard, but now that fibrous bone become weak and soft. Bone is more prone to fracture. Even slight injury also causes fracture. Sometimes spontaneous fracture. Sometimes I already told you, folding fracture, bending of the bone because of fibrous. Sometimes pathologic fracture. In advanced cases, resorption is to such an extent that bone become very weak. Even spontaneous fracture occurs. And because of this, the tendons and muscle attachments are in difficulty. There is detachment of tendons and muscles from the bone. Detachment. Due to growth of the fibrous tissue, there is reduction of the bone marrow. And you know the function of bone marrow, one is formation of RBCs, blood. So when there is decrease in bone marrow material, leads to anemia condition. Coming to the very important part for the clinician is clinical findings. Here, here it is not the monopoly of few bones. Almost all bones of the body are affected, but monopoly of facial bones. Predominantly facial bones are more affected, especially jaw bones. Very common disease in horse, it is called as big head. That is because of thickening of the facial bones. Here thickening is due to fibrous tissue. There is another condition in dogs called rubber jaw that is observed in advanced cases in some dogs, where the jaw bones become thickened, they become soft, they become pliable like elastic or rubber and can be easily fractured. Due to this, the dog is unable to close the mouth properly. So there is drooling of saliva from the mouth. There is difficulty in prehension and mastication of food. In advanced cases, the jaw becomes so soft that it can be twisted very gently due to degeneration of the bone and laid down the fibrous tissue. And so it is called as rubber jaw, observed in some of the old dogs in advanced cases. We continue here the clinical findings. The tooth are loosened and some of the tooth may be moving or may be falling. The joints become swollen and animal shows characteristic symptom that is lameness. Due to resorption and let down the fibrous tissue, there may be a spontaneous fracture. Means the animal develop fracture of long bones even after a slight minor trauma or minor injury. Sometimes there is folding fracture. Actually, it is not fracture but bending of the bone. Bone becomes so soft, just like rubber. Pathologic fracture in advanced cases. Characteristic symptom is shifting lameness. That is because of shifting pain. Pain jumps from one limb to the other limb. Shifting lameness. Because of the affection of the vertebrae, there is arching of the back. Continuation of the clinical finding. Because of the reduction of bone marrow due to growth of the fibrous tissue, the bone marrow become less. So there is severe anemia. We have to take care of animal by giving treatment also, treatment of anemia. Emaciation. And you know that this condition is called by hyperparathyroidism. So there are signs of hyperparathyroidism. And secondary hyperparathyroidism is caused by kidney disease. So clinician observe the signs of kidney malfunction or dysfunction. The symptoms are vomiting, dehydration, excessive thirst, urination, and depression. These are the symptoms of kidney dysfunction. You know that this is also caused by hypoparathyroidism. So the signs of hypoparathyroidism are the dog become restlessness. There are nervous symptoms. Animal become nervous, excited, intermittent tremors of the muscles, and sometimes convulsions, seizures are also found. Dear friends, share this information to veterinarians and veterinary students to support the channel and to continue the channel. Subscribe the channel. Thank you very much for observing this video. Next time I will come with osteodystrophy fibrosa part 3.